when we first meet with a patient.
Morning, Jay.
Good morning.
How are you?
I'm good. How are you doing?
I'm doing good. All right.
We'll do an evaluation. That's where we get to know what are their hobbies, what are things that they want to do, what have they done in the past. We try to set realistic expectations.
After evaluation by a certified prosthetist and orthotist, the second step goes to scanning or casting. That can be a 3D scanner or a casting that we normally use a fiberglass bandage to take the negative impression. And then after that, we pour the model with the plaster, or we can modify that model after scanning in the computer and send it for a 3D printing to do a test socket or a diagnostic socket. Then you try that on the patient to see how it fits. So if it needs any adjustment, you modify that model again and readjust the socket and do again the same process. Once you achieve the proper fitting socket, then you go for a second step is the lamination. That normally we use different material with some carbon fiber, Perlon, nylon, Nile gloss, and acrylic resin. That has a setting time, and then we get the actual socket.
We'll pull a test socket, and that's when we get into the whole fitting. We'll have the patient stand, just standing with the prosthesis, see if there are any pressure areas. What does that fit look like? We always want to have an intimate fit with the socket. The alignment are things that you have some adjustability with, but at the end of the day, the socket fit is one of the most important pieces of the whole prosthesis. You could have spectacular components underneath it, but if the socket fit isn't correct, they're gonna struggle with the device overall. There's a lot that goes into checking the fit, rechecking the fit. We check their skin when they remove the prosthesis, just to make sure that they're not getting any high pressure areas. As we move through, as the patient is comfortable with it, we like the fit, they like the fit, the alignment, everything starts coming together. We'll go through the lamination process where we make the finished prosthesis that we then issue to them to take home. The PO world has changed a ton. Seeing the changes and the advancements is a really cool piece. Seeing things become more accessible to patients and be able to adapt to their everyday life. You know, you can never make up for their leg that they lost, but if we can get the function close in that ballpark, I think that does a lot for the patient.
As a clinician, my main goal is to take care of my patients as much as I can and provide the service that the patient needs.